Hey guys, I just wanted to give a big shout out to Anchor. Now that it's my second year of podcasting, I thought you all should know that I've only used Anchor to record all of my podcasts. And if you haven't heard about Anchor, it's simply the easiest way to make a podcast. Let me explain. It's free. There are so many creative creation tools that allow you to record and edit your podcast right from your own cell phone and your own computer. Anchor then does the hardest part for you. They go ahead and distribute your podcast so it can be heard on Spotify, Apple Podcasts, and so many other platforms. Now, I think it's everything you need to make your own podcast in one place. So what are you guys waiting for? Go ahead and download the free Anchor app today and head on over to anchor.fm to get started. Have fun. Hey everyone, welcome back to all my listeners. Now, if it's your first time finding me, thanks so much and welcome. Now, you know what? I hope you're all having a great day so far because I know I am. It's finally March Madness time. It's my very favorite fun, and it's back, right? It's been gone for these couple of years due to the pandemic. So I was so happy on Sunday. It was Selection Sunday, and I've got all my brackets lined up. All my picks are on. I'm so incredibly excited to start watching. Now, unfortunately, so many of my old favorite teams that I've always picked year after year going quite far in my brackets are the Orange Men at Syracuse, and they're not here this particular year. And where are my Cavaliers at UVA? So many of my other favorites aren't even here. But anyways, oh well, it's all going to be great fun. And I can't wait to watch, again, these games and catch them night after night. I'm so excited. And I hope my brackets don't bust too early. They tend to do that. I'm not a big winner, but I'm a big fan of March Madness. So I can't wait. Totally thrilled. But anyways, you guys, welcome. Welcome to my 11th episode of Season 5. Today is Wednesday, March 16th, 2022. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. Now, all right, guys, I've got quite a bit to get into today. So I'm going to be diving into my compliance tip today and sharing the details on yet another new code for the monoclonal antibody Silgavimab, or the trademarked name EVUSHELD. And I go ahead and roll out the red carpet and introduce a very special guest, Kate Patskovska. And of course, I close out today's episode with some inspirational words on clarity and focus from Tony Robbins. If you checked me out on LinkedIn, you know I'm all about compliance and protecting our physicians and valued healthcare professionals when it comes to the business of medicine. I hope this week with me brings you enough to take back to your organizations, to want to dive in deeper, to use my tips and best practices to ensure success. I hope this podcast will help you boost the quality of documentation capture and improve coding accuracy as you help your providers paint the medical picture. If you like what you're hearing, please go ahead and hit that subscribe button now so you don't miss another episode. Please write in a review and kindly drop me a 5-star rating on Apple Podcasts or wherever you listen to my podcast. I'd really love your support. And guess what, you guys? Can you even believe? I know I can't. This is my 81st episode of my Paint the Medical Picture podcast series. I can't believe it. So many fabulous episodes with all of your support. I am so grateful. You continually push me up into the top 100 charts month after month. So I am so humble, so grateful. I'm also on the number 3 spot for FeedSpot blog for the medical coding and billing space. So many of you continue to listen and propel my numbers higher and higher. And I'm grateful, and that allows me to continue providing this podcast series to all of you, and I love it. So Thank you so much. I see you supporting me, and I am so grateful. Now, as always, a friendly disclaimer. Remember, I'm bringing you the news, current healthcare industry news, my compliance tips and recommendations based on my over 10 years of experience in front office, back end, coding, and billing for multi-specialty physicians, compliance, and auditing for both E&M and surgical operative reports. These are my opinions alone and are not to be construed as legal advice. So let's get into a very special Newsworthy that features my guest today, Kate Patskovska. I'm so excited to introduce her to all of you. Now, Kate is an independent medical biller, and she's an AAPC approved medical billing instructor. She started her career in healthcare back in 2007 with a utilization management company. Now, in September of 2019, she decided to narrow her focus on providing training and consulting services for other certified professionals, office staff, providers, anybody really that's in this particular space of healthcare. Now, this training and consulting focuses on medical reimbursement policies, some benefits investigations, and denial management, with emphasis on following the proper coding and billing guidelines. Now, she has quite a few speaking engagements that include webinars for the organizations of AMBA and BC Advantage Magazine and various AAPC chapters. Now, in November of 2021, she was in fact lucky enough to have published her first article with the AAPC's Healthcare Business Monthly magazine. Now, she currently works as an office manager for a private practice that specializes in asthma, allergy, and immunology. Oh my goodness, Kate, that is just incredible, incredible work that I've just read to my audience in this bio. So welcome. Welcome to today's podcast.
Thank you very much, Sonal, for having me today. I'm so glad to be here.
Oh, well, I'm happy that you are, and I can't wait for my audience to get to know a bit more about you. So thank you. All right, so you know what? You have been one of my biggest podcast supporters since the very start 2 years ago. So I'm incredibly grateful for all of that. Now, you know what? Based on this incredible bio that I just read to everybody, I hope you could share some of the points about why it is you're so driven in this particular space of healthcare that leads you to not only bill for your provider types of clients, but has also inspired you to teach to those of us that are new in this particular field and those of us who are trying to get into the field, in the working space. So I'd love to hear some more.
Yes, absolutely. Absolutely. So what motivated me to educate physicians and other certified individuals that are just starting out in this healthcare field, or individuals that work in the physician's office, was the fact that I saw betterment of oneself, as well as a better cohesiveness between the provider and the office staff. Let's be frank. Physicians went to school to study medicine. They did not study medical billing and coding, and newly certified individuals are still learning the ins and outs and how to navigate the healthcare field. So medical billing and coding field is complex, very complex, and not only due to the code sets that keep changing every single year, but also due to the fact that insurances keep updating and changing or completely removing their medical reimbursement policies. And that could happen as often as every 6 months. I actually saw it during the pandemic time in my local managed Medicaid plan. They changed some of the policies every 4 months. It was very difficult to keep in touch with all the changes that were happening for the physicians. But if you do train the staff, then you will be able to know what is coming up next. And the physicians will be able to help out with the billing and the coding and the compliance. Staying current and knowing where to find the proper information is imperative, not only for improving financial health of the physician's office, but also to the physicians themselves and the newly certified individuals, on individuals that are just working in a physician's office and are trying to work towards the certification. Maybe they want to learn a little bit more. Is this something for me? When I work for some of the clients, I try to kind of gauge to see what kind of people are working at the front office and who's working in the back office, and whether or not they are certified. And if they're not certified, are you thinking about getting a certification? And depending on what type of job do you want to do, duties, do you want to be certified as a coder, or do you want to be certified as a biller? Or do you want to be as a risk assessment? I mean, APC has so many different certifications. You know what I mean? So somebody may love just the coding. They want to deal with only the codes. They love the terminology, the anatomy and physiology. And then somebody says, no, I like to do the reimbursement policies. And that's one of the reasons why I actually decided to be certified as a certified professional biller, because I realized in my position that I was, and I am right now, being certified as a biller was more beneficial for me and for the physicians, because this way I would not only we were certified to learn about the codes, but we also were certified about the compliance and the billing part about it and different reimbursement policies. So it was extremely important for me. And I actually fell in love with billing. So I decided to be certified as a biller. And then I decided to become an instructor in medical billing. But again, somebody who's working at another office, they might say, no, I only like codes. I like to read operational reports or whatever the case might be. Some people like to be certified in primary care. Some people want to be in cardiology, for example. It all depends. So definitely having all of these things come together, it helps the cohesiveness for everybody to work together in the office and help them out. I always say knowledge is power. It basically helps everybody to work together, to bring everybody together and help them out. So that's one of the major things that motivated me to educate everybody, not only the physicians, but everybody else in the office.
I love hearing you. All of those points are incredibly important, right? I love hearing that you're all about bringing your physicians to understand that you're a part of their team, right? It's all about getting them on board and understanding that the billing and reimbursement side of what they do is vital, right, to the business side of their practice. So that's incredible. I heard that in the beginning, because you're absolutely correct. Our physicians do not necessarily get trained in their residency programs, their medical school training. Unfortunately, right, there are few and far between programs across the country to this day, it's 2022, that actually teach our younger providers, right, about what the business side, the coding and the billing actually does for them in the end when they're out in the quote unquote real world and practicing medicine, right? So you said that in the beginning, and that's incredibly, incredibly true. And then not only that, you have had a way to leverage yourself, right? In the sense that you can come in and talk to providers very clearly and distinctly about what it is you do possess and what you can offer. You are a certified biller, right? Which means you do have the knowledge and the experience to perform the billing services for them, right? And you have your own strengths depending on what your practices have been. And you can get into that in terms of what their specialties are, right?
Yep. I always look at it as any type of client that I started out. I try to gauge on what they know, how the office is, but I always approach it as a new experience. And then you gather that information. And then again, being certified and taking the test is just standardized, in my opinion. But then once you start actually going out there and reading these medical policies and breaking them down and looking at the fact that it is so complex when it comes to explaining to the providers that the codes exist.
Mhm.
However, based on what it is that you're performing and what type of insurance the patient has, you have to look at the reimbursement of medical policy to see whether or not any of this is covered. And that comes with experience because, again, as soon as the patient calls the office and you already have a properly trained staff member who knows how to verify the benefits for whatever the provider wants to perform, then it is easier because this way we are going to bill properly the first time. We don't have to wait until
Yes.
there's a denial or something else
Yes.
happens. And then all of a sudden we are fighting basically with the insurance. And then if something is not covered, the patient is not responsible for it because they will say that, this is uncovered. Like, for example, unlisted codes. Unlisted codes, I try to tell everybody, try not to use them
Right.
because if there is something
Mhm.
that corresponds to what you're performing, you have to use that particular code. You
Yes.
can't use unlisted codes because it is so much harder for you to prove why you use that code.
Mhm.
And then it's a battle going up and down, could be a year, trying to figure out why the insurance is not paying or trying to get payment for it. So educating the providers and having all of that information and then having the staff educated, it just helps out everybody.
I also agree with you that there have been so many payer policy changes throughout this pandemic as well. So I couldn't agree with you more. There has been so much complexity in the world of reimbursement. And I agree with you from state to state. I know you're in New York. I definitely have provider clients throughout the country, and I have seen this time and time again, and it is sad. But again, you and I like to focus on the fact that we are a part of the team, right? We like to work with our providers who understand the work that we can do for them will help them in the long run, right? We want them to keep their doors open, to continue providing excellent care to their patient population, which is what they were trained for many, many, many years, right? A long time ago. So, yeah, I love all of your points there. Incredible.
And not worry about the financials. I mean, right
Yes.
now, honestly, what I also noticed as part of the trend is a lot of DPC, the direct pay
Yes.
providers.
That is a trend,
And
upward trend.
yes, and I saw a lot of them in the primary right now, but I
Yes.
think at some point it's going to go into the specialties also, because then the physician is going to say, well, if I am, for example, in allergy world, if I am spending a lot of money for the serums to do an allergy test, and the price for those serums goes up because there's only 2 or 3 companies that actually have the serums that the allergist needs. But the insurance is only paying me $20, $30, and then the patient has to pay me an extra $20 and that's it.
Mhm.
Then how am I going to financially survive? So
Right.
then they will start saying, you know what, I'm also not going to waste my time. I'm not going to take the insurance. And then the reimbursement policies are extremely important because what I also have noticed is that physicians look at, oh, well, this patient has a commercial plan, so it's a great insurance, and therefore they're gonna pay me, what I should be
Mhm.
receiving. But in reality, again, once you check those benefits and you train properly, whether it's out of network or in network, they have to realize that it all depends on the contract that they have signed. Or out of network, now what's happening is that the insurances are also smart and they say, oh, a lot of providers want to be out of network, and they make higher percentages that the patient has to pay, or deductibles out of pockets, whatever the patient has to pay. So now the physician office has to go after the patient, and not everybody has a collection agency, not everybody has the staff or the time to pay. And go after the patient and tell them this is how much it's going to cost.
Mhm.
So having experience with different insurances and then
Yes.
different specialties, you yourself as a medical biller, you basically take all of that as an experience. You put that on the list, and then right away, once the patient calls, you right away know this is what you're going to get as a reimbursement, and you ask specific questions, and then you can go from there. So again, it is extremely imperative to have everybody at the office, including the physician, because now the physician will know what it is that the staff has done and why the physician is getting the reimbursement they're getting reimbursement for,
Mhm.
instead of just saying, well, I'm a orthopedist, or I am a orthopedic surgeon, or a cardiologist, or even allergist, for example, and they will just say, but I went to school,
Mhm.
I should be receiving more, I'm a
Right, right.
specialist. And they, if they don't know, then there's more questions than answers,
Mhm.
and it just creates a lot of division in the office. If you have everybody trained, everybody's on the same page, and again, everybody knows what's happening. Like you said, you try to help out the clients to keep their doors open. That's
Mhm.
basically what it is.
Yes.
Not everybody as a physician goes into business because they want to make money. You know
Right,
what I mean?
exactly. Yes,
They
absolutely.
go in to help out
Mhm.
the patients.
Mhm.
But if you cannot keep your doors open, then you won't be able to help out your patients. And sometimes when you do join a bigger group, it may be financially better for you, but I don't think it is better for the patients.
Such excellent, excellent points, Kate. Love them all. All right, so why don't we move on here to my next question? So it's along that same vein, right? We still want to know more about you, about your past and your history. We all have a past and a history, right? So if you can, hopefully you can share with my audience some of those steps that you took to get to where you are today. I'd love to know a little bit more about your journey overall on how you came to be this incredible medical biller.
Well, before I actually got into this,
Mhm.
I was doing administrative jobs, receptionist jobs, and then I got the opportunity back in 2007 to work with a company that was a utilization management company. So it's a third-party company,
Okay.
and what they were processing is in and out of network physical therapy, occupational therapy, and speech therapy requests. So these are the prior authorizations that the providers would send over to us, and then the physical therapist or occupational therapist or speech therapist, they would review them, and then the cases would be billed, and it would be either yes, this patient needs this therapy, or no, they do not need this therapy type of situation. And I worked on retrospective contracts, what we did Cigna, and basically we contacted the providers and asked them to fax us the notes, because the patient was already seen, but the insurance payer wanted to double check to make sure that the patient did really need these services. And then we would build a case and again give it to the physical therapy, occupational therapy, and then they would process it. And then later on in the same company, I was put in another contract that dealt with prospective reviews. So again, they would submit us the information. We want to make sure everything is there, and then we forward it to the physical therapist, occupational therapist, or speech therapy. So I did communicate with physicians, and that kind of put me into the role of you're in between, but like a medical biller, because you're always in between a physician and office staff, and you are with the insurances. You're on the phone, you're calling to find out what's going on with this claim, what happened here, why wasn't this paid, or we have an authorization, why was this denied, or whatever other things. But that basically gave me experience to be in between, and then kind of paved my way to go into the medical billing field. After that, I worked in several medical offices, so they gave me a little bit more, again, experience with calling to verify the benefits, the eligibility. And then I finally decided to get certified through the APC to get my certified professional biller. And then later on this year, I became also the instructor. So I decided to take it a step further, take the course, pass the exam, and become the medical billing instructor. And basically that gave me a little bit even more courage and an experience of actually to go out there and say, well, I also have a certification in being an instructor too. So, and kind of put more together cohesive information to show to the providers and try to make the process simple. Yes. I always try to make it as simple as possible so everybody on every level, whether you're provider, whether you're certified or you're not certified and you're thinking about getting certified, understands that information, because I believe that everybody they learn differently. Just like children, everybody as an adult also learns differently. So trying to break it down as easier as possible, it will give them, and I try to staple one topic at a time, but that's basically what it was. That's how kind of motivated me to become certified as an instructor lately. And
well, kudos to you. That's incredible. I love your thought process and the steps that you've taken, and kudos. And I love your overarching theme. And I believe what will make you, phenomenal in teaching everybody is the number one, mantra that I even had when I started working as a biller, first and foremost, is to make sure that you're billing claims right the first time, because you don't want to see those claims come back. So that point you made is one that I hold on to this day, right? So I think that's an incredible teaching mantra that you can continue telling everybody about, because it's true. If you do it right the first time, that's the goal, right? We don't want our providers, like what I see today currently on this back end of work that I do, right? I don't want to see providers getting those post-payment audits later, 5, 6, 7, 8 years down the road. Yep. And then those potential clawbacks, those takebacks of reimbursement monies. So I loved hearing you say that. And it is a resounding fact for me, is just do it right the first time.
And the astounding part that I actually found out, because I asked physicians, I asked them, do you know how long do the insurances have to audit you? Or some of the physicians will say, oh, but they paid me for this code. Why are they taking it away? Because some of them, they do recoupment without even if you file the claim with the same insurance on another patient, they do the recoupment of the previous patient on that claim. So the provider receives a zero, because now the insurance is doing that. But I have seen the astounding number, the percentage of providers, or even the people who work in the office, they don't know those compliance and those timeframes. They don't understand that the insurances do have that time frame to retro audit you. We had a case recently here in New York. It involved one of the managed Medicaid providers, payers. And what happened is they were actually bought out by another company. I'm not going to mention which one, but the company, once they bought them out, they decided to do a retroactive review of the paid claims specifically for allergy. Oh, this is one of the things that I also noticed, is that a lot of people say, they focus on things like cardiology, orthopedics, but in allergy world, there have been a lot of changes in the last couple of years. So, especially with the tests. And what happened in the situation was the fact that the primary doctors were ordering 600 allergy tests. And yeah, I know.
My eyes are blaring.
And then my physician is like, why is the insurance even paying for this? It doesn't make any sense.
Doesn't make any sense, right?
Yes. And they will they will do the blood work, and then they will order it. And then they paid them. But then the patient, is confused. They don't know what the results mean. And the primary doctor can't really explain it because, again, you have to go to a specialist.
Yes.
And a lot of times the patient will say, well, I want to do a redo. I want to do a redo. I want to do another test. And what happened is that particular payer again paid to the specialist. They actually audited the specialist. And some of the specialists had to pay a lot of money, in thousands, for seeing these patients in the last 3 years. So that affected a lot of physicians who are private, whether or not they're accepting this insurance. And we have seen an increased number in my office, for example, that the patient will call and say, oh, I have this insurance. I say, I apologize, we don't accept it. And they will be like, well, what if I pay you with cash? And I was like, unfortunately, in New York State, we are unable to accept that. That's illegal because you do have insurance and it is a managed Medicaid plan. So again, that comes compliance. And they are desperate because they're trying to find a provider who they can actually see in the office and, not deal with going to a clinic or something like that to do that. So we have, again, a lot of providers, they don't understand that there are time frames. And if you're not filing properly, if you're not documenting properly, if you're not compliant, if you're not billing the proper codes the first time, you are going to revisit this potentially a couple of years down the line. Tell everybody the same thing. You have filed the first time, you do it correctly. This is going to be so less headache later on to worry about this and be like, oh my gosh, now they're recuperating $1,000 or whatever the case might be. But yeah, in this particular case here in New York, it was thousands. For some of the providers, it was thousands of dollars. And unfortunately, patients suffered because now those providers said, you know what, I'm not going to see the patients anymore.
I can't
with
see
this
you anymore.
Insurance. Yeah,
because of your
the ones
insurance.
that I have right now, I'm still going to see, but the ones that are new, I am not going to accept any new patients with that particular insurance. So it negatively affects both the providers and the patients in this particular situation. So doing everything right, properly the first time helps out everybody on the long run.
And now it's time for my best practice tips in Trusty Tip. So in today's compliance tip, I wanted to focus on yet another new HCPCS code that was just released. Now, this pertains to COVID-19 monoclonal antibodies. There was a revised emergency use authorization for EVUSHELD back on February 24th. The FDA made a revision for the emergency use authorization for tixagevimab, co-packaged with silgavimab. Together, they are known as EVUSHELD for intramuscular injection use. Now, this revision for the EUA was to change the initial dose for the authorized use as pre-exposure prophylaxis of COVID-19 in certain adults and pediatric patients. Now, CMS created this new code Q0221, and it was made effective on February 24th. Now, let me go over some finer details here. Now, the long descriptor for this new HCPCS code, Q0221, is for injection, tixagevimab, and silgavimab for the pre-exposure prophylaxis only for certain adults and pediatric individuals, which means 12 years of age and older, weighing at least 40 kilograms, with no known SARS-CoV-2 exposure, who either have moderate to severely compromised immune systems or for whom vaccination with any available COVID-19 vaccine is not recommended due to a history of severe adverse reaction to a COVID-19 vaccine and or COVID-19 vaccine components. 600 milligrams. Now, the short descriptor of this new HCPCS code Q0221 is Tixagev and Silgav 600 milligrams. That's much easier for me to say, so I prefer the short descriptor, Tixajev and Silgav, 600 milligrams. Now, according to the FDA labeling and the fact sheet for healthcare providers, I'm going to go over some really important facts here. Now, the dosage of EVUSHELD for emergency use is, for the initial dose, it's 300 milligrams of Tixajev and 300 milligrams of Silgav administered as 2 separate but consecutive intramuscular injections. Now, the repeat dose, according to the FDA labeling and this fact sheet for healthcare providers, this repeat dose is for the SARS-CoV-2 variants that will be circulating in the United States when EVUSHELD may need to be redosed are not known at this particular time. Again, on February 24th, this was not known, and therefore repeat dosing recommendations cannot be made. And I double checked here. As of the recording of this particular episode, there is nothing newer or fresher than February 24th. Okay. Now, the fact sheets will be revised with repeat dosing recommendations in the future when more data are available. Now, remember to be mindful and continue using the existing administration codes here, and that is for M0220 and M0221. Now, let's go over some of the limitations of authorized use. Now, EVUSHELD is not authorized for use in individuals for treatment of COVID-19 or for post-exposure prophylaxis of COVID-19 in individuals who have been exposed to someone infected with SARS-CoV-2. Pre-exposure prophylaxis with EVUSHELD is not a substitute for vaccination in individuals for whom COVID-19 vaccination is recommended. Now, individuals for whom COVID-19 vaccination is recommended, including those individuals with moderate to severe immune compromise who may derive benefit from COVID-19 vaccination, should receive COVID-19 vaccination. And in individuals who have received a COVID-19 vaccine, EVUSHELD should be administered at least 2 weeks after vaccination. Now let's go over some ordering requirements, right? EVUSHELD may only be prescribed for an individual patient by physicians, advanced practice registered nurses, and physician assistants that are licensed or authorized under state law to prescribe drugs in the therapeutic class to which EVUSHELD belongs. And finally, let's remember that EVUSHELD is authorized only for the duration of the declaration that circumstances exist justifying the authorization of the emergency use of EVUSHELD under Section 564B(1) of the Social Security Act in 21 U.S.C. Section 360 BBB-3B1 unless the authorization is terminated or revoked sooner. Now, that's pretty amazing, right? Now, let's not forget that this PHE might be over here within a couple weeks in April. So let's be mindful of all of the goings on in the next few weeks ahead. It's fundamental, if you have Medicare as a payer, to keep your eye on correct and compliant coding and billing practices and make sure you are adhering to them to ensure you are meeting all the requirements from the very start. When the documentation paints the medical picture with clarity and vibrancy from the onset of care, a certified medical coder can then abstract codes with accuracy. And finally, I focus Season 5 Spark on clarity and focus. I want this 5th season Spark to be filled with the world's thought leaders, writers, artists, philosophers, everyone who inspires the need for clarity and focus in all that we do. So, in this week's inspiring quote in Spark is from the great motivational speaker, Tony Robbins. Most people have no idea of the giant capacity we can immediately command when we focus all of our resources on mastering a single area of our lives. Absolutely true, right? I think this particular quote applies to this space of healthcare as well. The space of healthcare coding, the space of healthcare compliance, is centered around detail and focused work on improving clarity. I think those of us in this space are relentlessly focused on the mastering the details here as well. I am happy Tony Robbins' spark still burns brightly in all of us today. So that wraps up today's episode. And as always, I appreciate you all diving into today with me. If you want more information from me, please go ahead and follow me on LinkedIn. I'll leave links to everything in the show notes below. Please have an amazing week ahead, and please continue staying safe and healthy. Thank you so much for listening in on today's very special episode, and I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.